listening to Local News Live, a community service brought to you by AOC Community Media in partnership with The Advocate, our local news source. You're hearing this morning on AOC 1, which would be LUS 3 and Cox 15 on your cable system. You can also hear this and watch our slides and our presentation on YouTube if you search for AOC Community Media on YouTube. And you can always listen to us even if you're on the go. Our mobile stream is half the data, so you can even listen on your data plan, probably without causing any problems if you have unlimited data or a lot of data. On Cypress Street Radio, found at aocinc.org/csradio, or you can just search for Cypress Street Radio, which is our streaming internet radio station. I'm Matt Roberts. Good morning, everybody. And before I get started with the news, I did want to give a shout out to Dig CC Mixter. That's dig.cc.mixter.org. That is the website that we have been using the music from. The music is free for commercial use. That's the most, the largest category, or one of the largest categories. They have multiple categories, though. And if you are a content creator, like we know so many of you are out there, this is a source for a lot of original music that has been created and shared, oftentimes with no or few strings attached, I should say. They have what's called a Creative Commons license, an attribution license, which means you're free to use it as long as you share attribution for the creator. So what I've done to sort of streamline that process is I've just created this slide that shows that web page with each song that we're playing. So if you're wondering what the song is, you can see the name next to the song that's playing. You can usually see it down at the bottom there too. And you can download and get all those credit information. All right, just had to give a little plug to Dig CC Mixter for all that music provision and all those creative and thoughtful creators out there. So without further ado, let's get to your news this morning. Temporary New Orleans facility to wind down. Hospital at Convention Center won't fully close. This is by Sam Carlin, a staff writer with the Advocate. Governor John Bel Edwards' administration is crafting plans to wind down a $165 million temporary hospital facility at the Ernest N. Morial Convention Center in New Orleans, but will leave beds in the facility over the next several months as the state moves through a phased reopening that could produce another spike in cases. Likewise, Edwards' administration and Lieutenant Governor Billy Nungesser will keep 3 of the 21 state parks operating as isolation sites for people who have been infected but are homeless or can't go home for other reasons, even as Nungesser begins opening the other 18 parks for in-state residents to use recreationally. The temporary hospital facility at the Convention Center was the cornerstone of the state's plan to prepare for an onslaught of coronavirus cases expected at hospitals in the New Orleans region, as officials discovered an alarming rise in cases in March and April. But Edwards' stay-at-home order, which will be lifted Friday, nearly 8 weeks after taking effect, has tamped down the spread of the virus considerably. Only 17 people are in the Convention Center, and 190 have been treated there, according to the Louisiana Department of Health. And the governor said the rate of transmission is estimated to be lower than 1 in parts of the state, meaning someone with the virus can be expected to infect less than 1 other person. Still, Edwards said the plan for the Convention Center, which has not yet been finalized, would leave beds in the facility for several months. Similarly, the 3 isolation sites at Bayou Segnet Park in West Wego, Chico State Park near Ville Platte, and Lake Bitno State Park near Doylen will remain open to house coronavirus patients in case the number of infected surges as the state reopens its economy. We hope it doesn't happen, but this particular virus could flare, and we could have a resurgence of cases, and they could spike, and we would need these trailers again, Edwards said. We are in the process now of coming up with a phased approach to taking the hospital beds out of the Montreal Convention Center, but doing so in a way that for the next several months will leave a nucleus of beds in there so we will have the flexibility as well. The Convention Center facility comprises an estimated $165 million of the state's $473 million in expenses from the coronavirus, according to the latest figures provided by Edwards' administration. While the total amount spent has fluctuated as the state cancels orders for ventilators and other equipment it no longer needs, Mike Steele, spokesman for the Governor's Office of Homeland Security and Emergency Preparedness, said the bulk of the spending on the Convention Center facility is locked in, though it could change some if contracts are extended or shortened. The Convention Center facility was erected in late March as the coronavirus raged through New Orleans, making the city one of the nation's hotspots. Officials predicted hospitals would be overrun and run out of ventilators to treat patients if the number of cases didn't wane quickly. A unit that was stood up across the street from the convention center to house people who were suspected to have the coronavirus but awaiting test results is no longer being used, Edwards said. Edwards' administration is finalizing rules for businesses reopening under the first phase of loosened restrictions starting Friday. Restaurants will be allowed to offer dine-in services, and retailers, gyms, and a host of other businesses will also be able to operate, though all are restricted to 25% capacity. As that reopening approaches, the governor and state health leaders are urging people to wear masks and embrace the continued restrictions in place to make sure the state doesn't experience a rebound in cases that could prompt officials to clamp down again. Wearing a mask needs to become universal, something that we're comfortable doing, especially when we're around people who are not our immediate household members, said Dr. Alex Bio, Assistant Secretary for the state's Office of Public Health. If people follow state and federal health guidance, wearing masks, staying 6 feet away from others, staying home when sick, and listening to advice from contact tracers to inform people when they may have been exposed, Edwards said the state can have tremendous success in loosening restrictions on the economy. On the other hand, the reopening presents serious risks, especially in a state where the virus has proved more deadly than most others. Edwards pointed to a recent case in South Korea, an international model for successful virus response where a man who was unknowingly infected went to 5 nightclubs in Seoul and sparked an outbreak that prompted officials to shut down bars. Edwards pointed to that case to illustrate the precarious nature of reopening and to explain why bars are not included in the first phase of Louisiana's reopening. Bio described the businesses included in the first phase as those that have a lower risk and that can limit the amount and duration of contact between people. Nungesser, who oversees the state parks, said aside from the 3 parks serving as isolation sites, the rest will open in Phase 1. Reservations for campsites or cabins from out-of-state residents are being canceled during Phase 1, he said. Our next story is headlined, "I am saddened by it. As businesses reopen Friday, those in mall will remain closed," by Adam Daigle, Acadiana business editor. The staff at Watch Me Grow Up Boutique began curbside service this week in the parking lot of the Acadiana Mall after weeks of trying to move merchandise via Facebook. It hasn't been easy. The business that began in a shopping cart in the mall almost 15 years ago and is now housed in a 5,000 square foot space is trying to find its footing in the COVID-19 retail space, one that will be left out of the first phase of recovery process that begins on Friday. When Governor John Bel Edwards lifts the stay-at-home order on Friday and the state moves into the first phase of reopening the economy, malls and a few other businesses will be watching from the sidelines. Gyms, barbershops, hair salons, casinos, bars with food permits, and other businesses will be able to reopen with 25% capacity. Merchants in interior shopping malls must continue curbside service until June 5, when the state may move into the second phase. "We're just trying to do a little bit right now and see what's going to happen," said Lucretia Huval, owner of Watch Me Grow Up Boutique. "It's really hard when you have a children's store because you have to try merchandise on. We do a big shoe business. We have masks for children that they don't have to try, but it's really hard for us. But I'm not in charge. I'm not the governor. I have to follow the rules. I'm saddened by it, and hopeful we can make it through. Huball's business was one of a handful offering curbside service at the mall, which began May 1st. Only 4 others, Altered State, Chico's, Phenom, and Furniture Plus Bedding, are offering curbside service, mall manager Nikki Nugier said. Other stores have employees working and fulfilling online orders and shipping them out, which seems to be the best option at the moment, she noted. Melia, which sells personalized women's backpacks and handbags, has not reopened its Acadiana Mall store for curbside and will not offer the service at its other stores in Baton Rouge and Lake Charles, owner Sam Yu said. The curbside service takes away from the experience of the shopper in his stores, he noted, which is a part of his business model. The news of extending the closure for shopping malls, he said, was nothing to get upset over. At this point, what else can we possibly do, said Yu, who opened his Lafayette store in 2016. Being upset is not going to fix the issue. The only thing we can do is everybody do their part and everybody come together. I know it's hurting everybody. Having a business up and running doesn't necessarily help at all because the general public doesn't feel safe. Having a business up and running without customers doesn't help us at all. Some shopping malls across the country are reopening as states begin to revive the economy, but others, like the Acadiana Mall, will remain closed. CMall Property Group, which operates 209 properties across the country, expects to open half of its properties within the next week. Just like stores in those malls, businesses in the Acadiana Mall will have to adjust the best way it knows how. Watch Me Grow Up Boutique missed the spring sales and other seasons into the summer, Huball said, and now workers have to prepare for the back-to-school shopping, if school starts in the fall. Her 9 employees have worked at the store since the shutdown began and even volunteered in the beginning to keep things going, she said. Our merchandise is seasonal, Huball said. After Mardi Gras, we have First Communion, Dedication, Easter, Mother's Day, all that we lost. What do we do with all our spring merchandise that we filled our store with? We try and move it the best we can. I don't know. I think I'm taking it 1 week at a time and pray and hope for the best. At the Northgate Mall, some tenants are doing curbside service while the restaurant is taking to-go orders, but the order excluding shopping malls is hurting Northgate's barbershops, beauty shop, and nails shop because those businesses don't have an exterior entry. Manager Lisa Champagne said, those types of businesses not in a mall will be allowed to reopen Friday. Champagne contacted Lafayette Consolidated Government this week to plead the mall's case while crews have been scrubbing and sanitizing the floors to make it as clean as possible. We don't have a lot of people walking around. I hate to say that, but it's a fact, Champagne said. We should be able to open up the mall. I have 2 barber shops, a beauty shop, and a nail shop that can't open up. It's not fair at all. Casinos can open, and theaters can open, and all those places are going to have people in closer proximity than walking in the mall, she said. All right, let's do a PSA now, and then we'll get right back to the news. So our first PSA of the morning is stop the spread, call instead. Hashtag stop the spread, all one word. For the latest COVID-19 updates and information, visit www.311lafayette.services. Call centers with volunteers and medical professionals are active 24/7 to answer your questions about COVID-19 and determine if you need to get screened. You may also call 311 and press option 2 if you are a business owner, employee, or are looking for a job to get information about applying for small business recovery loans, apply for unemployment benefits, and related programs. This is the last week that free lunches will be served daily starting at 11 a.m. at the Robichaux Center located at 1919 Eras Landry Road. The Robichaux Recreation Center is open for to-go lunches. Only a limited number of lunches will be available for pickup for individuals who find themselves suddenly and no fault of their own unemployed or underemployed due to the COVID crisis. Thanks to the Drew Brees Foundation for making that happen in walk-ons. And again, this is the last week, and if you do find yourself in need of lunch, they're asking people to show up there at 10:45 a.m. Okay, let's get back to news there. Our next story, Lafayette Helpline sees spike in housing calls. Crisis may be pushing more to the brink of homelessness, by Claire Taylor, staff writer. The coronavirus response, excuse me, which included shutting down most businesses in mid-March, may be pushing more Lafayette Parish residents to the brink of homelessness. Governor, Governor John Bell Edwards placed a hold on evictions during his stay-at-home order. However, with that order expiring Friday, some renters may soon find themselves without a home. Since March 11th, 925 Lafayette Parish residents have reached out to the 211 helpline with questions about housing and shelter. Most of the calls were placed in the past 4 weeks. According to data from 211, in the early days of shutdown, only 11 callers inquired about housing. In the 2 weeks that followed, April 1st through 15th, 130 Lafayette Parish residents called about housing. The calls increased dramatically after April 15th. From April 16 through 30, 381 residents reached out to 211 regarding housing, and in the first 10 days in May, another 403 inquired about housing. Most of the calls came from the 70501 zip code, an area in Lafayette bordered by Mud Avenue, Louisiana Avenue, Moss Street, and Sunset Street. In the area, which includes some neighborhoods whose residents face socioeconomic challenges, 582 people called 211 about housing since March 11th. But residents from other parts of the city and parish also reached out with questions about housing and shelter assistance. Around 121 residents of the zip code 70506, which includes the Lafayette High and S.J. Montgomery school neighborhoods, part of Cameron Street, Congress Street, Eras Landry Road, Ridge Road, and Duyon Road, placed calls asking about housing between March 11th and May 10th. 61 calls about housing were placed by residents of zip code 70508, which stretches from near Lafayette Regional Airport south to Milton Avenue and includes parts of Barrett School Road, Camellia Boulevard, Settlers Trace, Pinhook, Collie Saloon Road, and Ambassador Caffrey Parkway. 36 people called about housing issues from the 70507 zip code in the northern part of the parish, which includes Pont de Mouton Road and Gloria Switch Roads, according to the 211 data. Another 21 calls were placed to 211 regarding housing from the 70503 zip code, which stretches across a large section of Lafayette, including Bendel Gardens, Rivers Bend, and Broadmoor subdivisions, Acadiana Mall, Robley Drive, and part of East Broussard Road and Cresslawn Drive. Kim Boudreau, Executive Director of Catholic Charities of Acadiana, said in a May 12th story in The Current that referrals to the agency seeking shelter, normally around 20 a week, are up to 60 per day. With nonprofits feeling the crush of limited funds and the upswing in demand for housing assistance, Lafayette Consolidated Government early in the coronavirus crisis received $850,000 in emergency federal community development block grant funds that can be used to help those affected by the crisis with rent. Instead, Lafayette Parish Mayor-President Josh Guillory wants to distribute the money to small businesses in the form of cash grants. Guillory said at a news conference Wednesday that he'll ask the city and parish councils next week to approve his proposal to distribute grants to small businesses forced to close by the governor's orders that don't qualify for other assistance such as small business administration loans and emergency disaster loans. They may include hairstylists, barbers, day spas, tanning salons, musicians, and massage therapists, he said. We're talking about businesses with nowhere else to turn, Guillory said. LCG is working with the Lafayette Economic Development Authority to establish criteria for businesses to apply for the cash grants, he said, which may be supplemented by the Economic Agency. I'll just take a little sip of coffee right here. Apologize about the weed whacker noise in the background there, but I am on in my backyard reading the news, and my neighbor needs to be weed whacking right now, so hope you can all stand it. Please bear with me, and I'm sure it'll be done soon. All right. Advocates say Louisiana child care centers need $71 million in aid. Just 31% of facilities are open in the state, by Will Sintel, staff writer. Louisiana child care providers have lost $30 million because of the coronavirus pandemic and need more than double that to help restart the economy, advocates and key business leaders said Wednesday. The request for aid totals $71 million, mostly federal dollars. The money would help providers, most of whom who have closed because of the virus, to reopen and remain solvent while serving smaller numbers of students at affordable rates. Without increased investment in early child care and education, parents and caregivers working in every industry will not be able to return to work and keep the economy moving, said Libby Saunier, executive director of the Louisiana Policy Institute, a child advocacy group. Others who joined the announcement included Camille Conaway, senior vice president of the Louisiana Association of Business and Industry, Michael Hecht, president and CEO of the Greater New Orleans Inc., and former state Senate President Randy Ewing, a member of Louisiana Board of Regents. The State Department of Education has said only 31% of the state's 14,000 publicly licensed centers remained open amid dwindling attendance caused by the virus and parents staying home. About 200 are closed in the Baton Rouge area. A survey done by the Institute in March said providers had lost $1.7 million initially. Saunier said she was surprised to see the latest survey, taken April 13th through 20, showed operators have suffered much higher losses than initial estimates. That is staggering, she said. How do you make up for that? Conway said child care centers are essentially small businesses and they operate on small profit margins even before the pandemic. Officials said 98% of centers that remain open are serving the children of essential workers. Those closed affect about 83,000 children, they said, and child care centers say that they need an average of 23,000 to reopen. More than 1 in 3 centers say they will remain closed permanently if the shutdown continues, according to the latest survey. Those sites care for more than 12,000 children and employ about 2,000 full and part-time workers. The request includes $26 million in federal funds to finance increased cleaning and sanitation at the centers, rehiring, screening staff, and operational expenses. Another $20 million in federal dollars would allow centers to operate with smaller groups of students while keeping tuition at pre-pandemic rates. Health guidelines require smaller groups, which reduces the enrollment capacity at child care centers. Advocates said without assistance, those caps would spark tuition hikes of 35% for infants and over 60% for 4-year-olds. Operators of nearly 3 out of 4 early learning centers said earlier they are not collecting tuition during the pandemic. The state is getting at least $8.1 billion in federal aid to help combat the costs of health emergency. Whether any of that money can be used to provide relief to child care centers is unclear, Ewing said. Ewing said there is wide agreement on the merits of early child care. Here is the hitch, Ewing said. It costs money, lots of money. Heck said stabilizing the industry is needed both to educate children and to allow parents to return to work. We think that the need for early child care is so essential that we are putting it up front to opening the economy, he said. Governor John Bel Edwards announced Monday he is lifting some of his stay-at-home restrictions effective Saturday, which will allow more employees to resume work. The other $25 million of the $71 million requested would be state aid to help subsidize low-income families of 4,000 children so they can afford child care while they work, attend school, or undergo job training. Backers said the subsidies are especially needed because more than 361,000 state residents have filed for unemployment benefits because of the pandemic. Edwards included the $25 million in his initial operating budget, and supporters were heartened that the issue was gaining visibility after years of efforts. However, that request may be a casualty of the $1 billion hole in the budget triggered by the pandemic. All right, and so our next story is titled COVID Toe? A bizarre post-coronavirus symptom takes things to the extremities by Leslie Carty, contributing writer. On April 7, Karen Shelter awoke in the middle of the night to a toe that was throbbing violently. She threw back the covers to reveal her purple-colored middle toe. I wonder whether I had somehow broken my toe, said Shetler. I iced it, not understanding what it was, and called my physician sister in New Orleans the next morning. She asked if it might be gout. It wasn't. Her purple toe was part of her previous diagnosis of COVID-19 caused by the new coronavirus. Even though her symptoms from the infection had subsided, she now had a post-viral inflammation that doctors are beginning to see all over the country. Photos of Shelter's toe were sent to Dr. Aaron Baugh, chairman of the Department of Dermatology at the Tulane University School of Medicine. Bo was already familiar with the issue. It has absolutely the same look as something called chilblains, which is an inflammation that occurs in fingers and toes in response to cold, said Bo. Now, however, we are seeing it as a post-viral response in patients who've had COVID-19. We usually see this in people who have brisk immune systems, which successfully fight off the virus. However, when the immune system gets cranked up like this, sometimes it doesn't shut off and goes a little crazy. We don't really know just how widespread this particular response is, but 20% of COVID patients have some sort of skin manifestation associated with this new coronavirus. The condition has been referred to as COVID toe, and it can affect one or all 10 toes and fingers. The 3 weeks after Shetler's toe had healed, more problems arose. This time, my right arm became achy and then extremely painful, said Shelter. Hours later, I was driving and I noticed my pinky finger was becoming numb and turning purple. Many people who get these conditions never connect it to COVID-19 because they are symptom-free and never realize they've been infected. Bo said, only subsequent antibody testing reveals they have indeed been exposed to the virus. Whether it's an inflammatory response or little viral particles causing the problem is unclear, said New Orleans dermatologist Mary Lupo. The good news is that no one has lost toes or fingers over this. We're seeing this in the extremities because it's the end of the line in the circulatory system. So it could even be seen on the ears and nose as well. Treatment with pain relievers, topical steroid creams, and antihistamines seems to remedy the condition fairly quickly, Lupo said. The physician said they're not certain why these chilblain-like symptoms are associated with COVID-19, but they noted that one of the hallmarks of the virus is inflammation. That can show up as skin lesions or rashes, such as those now being seen in children, which doctors believe may be caused by an inflammation of their blood vessels. Dubbed pediatric multisystem inflammatory syndrome, it has caused some children to go into heart failure. While plenty of cases of COVID toe are showing up in New York and California, where coronavirus outbreaks have been large, fewer cases are being seen locally. Bo said it's probably because many people and doctors don't realize it's related to COVID-19. Those who get it probably just think it's a skin disorder and they take a pain reliever and it goes away, Bo said. She also theorized that South Louisiana may have a different strain of the virus. There have been multiple mutations. But mostly, Bo said, she thinks people here are hesitant to go to the doctor out of concern of coming in contact with infected people, so they're living with it. Until we have biopsies where we truly understand what's happening with the blood and the skin, we're surmising it's a dermal vascular response, said Lupo. But the thing that makes this virus so scary is that we haven't been able to put it in a box, describe it, and know what to expect. The doctor said if you have purple toes or fingers, it's time to get an antibody test to see if you've had COVID-19. Our next story, and in fact, let's go for a little PSA break now that we're at about the half hour. All right, let's see. Medicaid, keeping calm through COVID hotline. If you are feeling overwhelmed with stress, fear, and anxiety about the uncertainty surrounding this public health emergency, there is a special Keeping Calm Through COVID hotline you can call. This connects you to trained, compassionate counselors who can offer support and who can direct you to mental health and substance abuse counseling services. Trained counselors available 24/7. All calls are confidential. Call 1-866-310-7977. Medicaid resources. If you have lost your job or if you have reduced hours, you may be eligible for Medicaid. You can apply online at mymedicaid.law.gov. That's mymedicaid.law.gov. cdc.la.gov. You can also apply by phone by calling 1-888-342-6207 or by mail by sending information to Louisiana Medicaid, P.O. Box 91283, Baton Rouge, Louisiana, zip code 70821. Local Medicaid offices are currently closed to the public. If any additional assistance is needed, you can call 1-888-342-6207. And we will get right back to the news now. Our next headline, nursing home deaths near 40% of total in Louisiana. State officials vow more testing, by Famon A. Roberts III, staff writer. Nursing home deaths attributed to the coronavirus inched toward 40% of the state's overall death toll, according to numbers released by state health officials Wednesday. Even as Governor John Bel Edwards vowed that the state was aiming to test every resident and every worker at any facility where adults live in close proximity. Of the 2,315 deaths statewide attributed to COVID-19, the disease caused by the virus, 863 have been nursing home residents. The 863 represent about 37% of the total count, a bit higher than one-third, where it had hovered for several weeks. Edwards said Wednesday that the state was ramping up its testing in nursing homes, in accordance with a White House call to test every resident and worker in a nursing home. We are working on a plan that will accomplish that goal, he said. We have known from the beginning that nursing homes are one of the places that are most conducive to the spread of the virus, he said. Nursing homes are particularly fertile places for the virus's spread, Edwards said, due to the consistent movement in and out of staff, many of whom may be asymptomatic carriers of the virus. The virus often exacts a deadly toll on residents who often suffer from the underlying health conditions that enhance their vulnerability. And while getting everybody in the homes a test is a good first step, it's not enough, Edwards said. We need repeated testing, he said. Residents who may test negative one day could test positive a few days later. You've got to go back and test again, especially the staff, Edwards said. In each of the 9 regions the state has been divided into by the Louisiana Department of Health, medical directors have put together strike teams of health workers who will go into homes and assist testing residents and staff. In southwest Louisiana, a team helped a home test 136 residents and more than 150 staff, he said. A similar effort was undertaken in Shreveport, but Edwards did not provide details. The Louisiana Department of Veterans Affairs, which operates the Southeast Louisiana Veterans Home in Reserve, where at least 28 residents have died and more than half the residents were infected, has been testing and retesting residents and workers, Edwards said. As of Tuesday, a Department of Veteran Affairs spokeswoman said there has been no new infections in the home in 2 weeks. St. John the Baptist Parish Coroner Christy Montague said there were no coronavirus-attributed deaths from the home in 8 days. The Veterans Home is far from the only such example. WWL-TV reported there have been deadly outbreaks in Covington, where 21 died, at Forest Manor Nursing Home, and rehabilitation in Slidell, where 18 died at Greenbrier Community Care Center. Lambeth House in New Orleans, the first cluster identified in the state, has also reported 21 deaths. And Legacy Nursing Home and Rehabilitation in Port Allen has had 16 residents die. Of the 279 licensed nursing homes in Louisiana, 197 have reported at least one case of the virus, and 3,840 infections have been reported in nursing homes. According to Wednesday's release from the Health Department, other adult residential care facilities, including inpatient drug treatment centers and mental and behavioral health homes, have reported 58 deaths and 501 cases, the numbers show. Monday, the state will begin reporting the names of every nursing home or adult residential care facility that has a case. In the early days of the pandemic, in March, the state was reporting clusters of cases in homes around the state. But as the numbers grew, the state moved to an aggregate reporting system favored by some other states. Our next story House committee advances gun rights bills by Mark Ballard, Capitol Bureau editor. A Louisiana House committee Wednesday advanced 3 gun rights bills, including one that would allow people to carry guns into churches, regardless of what the congregants say, as well as another that would remove a local government's ability to regulate firearms at playgrounds, public buildings, and commercial establishments in its jurisdiction. The Administration of Criminal Justice Committee, on a 10-to-1 vote, sent to the full House legislation that would repeal the current law, which requires the permission of the congregants to allow a concealed handgun permit holder to go packing at church services in a church, synagogue, mosque, or similar place of worship. Common sense should tell us that we shouldn't have to protect ourselves in church, said State Representative Brian Fontenot, the Thibodeau Republican who sponsored House Bill 334. Criminals have certainly defined another narrative for us, he said. Will Hall of the Louisiana Baptist Convention helped create the existing law that allows congregations to decide if concealed guns are allowed in a church. He said HB 334 would remove the ability of congregations to decide what they want for their own churches and probably force them to hire security because they won't know who is carrying firearms into the sanctuary. On a 7-to-3 vote, the committee advanced legislation that would remove an exception in the current state law that allows parish and municipal governments to regulate where firearms can be carried within their jurisdiction. Karen White of the Louisiana Municipal Association said no evidence has been shown that local ordinances have caused any problems, except for a few anecdotes about incidents in other states. But what House Bill 140 would do is obliterate ordinances in communities like Baton Rouge, Mandeville, Hammond, Kenner, and Thibodeau that limit carrying firearms into playgrounds, water parks, public buildings, and commercial establishments where families and children visit. Supporters of HB 140 argued that allowing local authorities to decide has created a patchwork of laws across the state. Radio show host Tom Gresham of Mandeville pointed out that Louisiana has 367 jurisdictions, and that could easily make people traveling from one to another an unwitting criminal. This would have the state legislature decide on behalf of all 64 parishes, said Representative Blake Miguez, the ERAF Republican sponsoring House Bill 140. When Mike Weinberger was asked during testimony if local officials had any rights to come up with the rules governing the people of their community, he replied that laws have failed to protect people from criminals. Those laws don't work, said Weinberger of the Home Defense Foundation in New Orleans. That's why we have to defend ourselves. Testimony was passionate, often angry, and led to one person being ejected from the hearing. Nolan Butte, a member of victims' rights groups, questioned legislators who were looking at their cell phones. Sorry, you paying attention to me? Butte asked Representative Tony Bacala, the Prairieville Republican sitting as chairman of the committee. Bacala told Butte that procedures did not allow for witnesses to question committee members. This is what I was talking about, the Wizard of Oz mentality and the people wanting to be the wizard, Butte replied. Bacala ordered Butte to be escorted out of the building. Our victims are dying on the streets, Butte said, as the sergeant-at-arms grabbed the microphone. This is our legislature, fantasy land, Butte said as he left the hearing room. 64,000 deemed to be ineligible kept on Medicaid by Melinda Deslate, Associated Press. Louisiana is keeping 64,000 people in the Medicaid program who otherwise would have been kicked off the rolls because of federal aid requirement enacted for the coronavirus pandemic. It's unclear when they'll be removed from coverage, the state health department said Wednesday. The congressional aid package passed in response to the virus outbreak increased federal financing for state Medicaid programs. Louisiana Department of Health Chief Financial Officer Cindy Reeves, R-I-V-E-S, recently told lawmakers that the state received about $250 million in extra Medicaid funds from the legislation. But the boosted financing came with a requirement that states couldn't cut coverage for Medicaid recipients unless a person asks to leave the program, move out of state, or dies, according to the health department. That means people deemed ineligible for continuing coverage because they make too much money don't meet other criteria, or didn't respond to requests to verify their eligibility can't be booted from Medicaid. In Louisiana, that's kept more than 64,000 people receiving government-financed health coverage who don't appear to be eligible for the state's program. Federal aid so far is covering the cost. The health department isn't sure how long they'll have to keep the ineligible people enrolled in Medicaid. Agency spokeswoman Kelly Zimmerman said the requirement ends whenever the federal public health emergency declaration expires. At that point, the state will need time to work through the eligibility verification process to determine who should be removed, Zimmerman said. We don't know how long we're going to have these people on the rolls. We don't know how long it's going to take to get them off, Rivas told the House Appropriations Committee during a recent budget hearing. Louisiana contracts with private companies manage the care of most of its Medicaid enrollees. The state pays a monthly fee for each person enrolled in a health plan with the companies, so the state has been paying that fee for the 64,000 people who stayed on the rolls during the coronavirus outbreaks because of the federal requirement. The nearly $50 million cost for those Medicaid patients through the budget year that ends June 30th has been covered by the extra federal financing Louisiana received, the health department said. All right. Our next story is by Katie Gagliano of Lafayette Parish. She is a staff writer for The Advocate. School board passes $576 million budget. The Lafayette Parish School Board unanimously passed a $576.6 million budget for the 2020-21 school year Wednesday, but the possibility of a budget shifting and cuts is on the horizon as the district assesses the coronavirus pandemic's effect on sales tax revenue. The budget was passed in an 8-0 vote with board member Timmy Chasson absent. About $305.8 million of the budget went into the system's general fund, which covers staffing costs for schools and system offices, utilities, and other operational costs. The general fund included $2 million for annual step increases or salary adjustment for employees, funding for additional teacher slots, including 6 intensive algebra teachers and additional special education facility, and funding for 2 more social workers, among other increases. The budget also included $2.8 million transfer from the general fund to the self-funded construction fund earmarked to rebuild Karen Crow Heights Elementary, Lafayette High, and Prairie Elementary. Board President Britt Lacheles said the facility's investment falls in line with the board's goals and history of facilities expenditures over the last 5 years. Building new facilities and revitalizing existing infrastructure is one of the board's main goals. He also highlighted investments in the classroom, including added teacher slots, as a win for the budget cycle. I think Superintendent Irma Trosclair was able to put some things into play in the budget that directly impact the classroom. And that's what we want. We want to directly impact the classroom as much as we can, Lachelet said. Though the budget didn't initially require significant cuts to balance, that may change as sales tax collections for the previous 2 months are solidified. Many stores and businesses have been closed or operating under limitations to combat the spread of COVID-19, reducing sales volume. Billy Guidry, Assistant Superintendent of Business Services, said it's still too early to definitively say how the pandemic may impact the district's budget in the coming year. Sales tax collections account for about 25% of the district's general fund budget, and property taxes about 26%, with most remaining funds coming from the state's minimum foundation program, he said. We know that there's going to be an impact, but the challenge becomes how much of an impact, Guidry said. Sales taxes are collected by the district the month after the money is spent, so numbers for April's sales taxes won't be sorted until the end of May and will be fully tabulated by the first week of June, he said. Although some early data from March is available, Guidry said it isn't enough to base wider estimations. Having more data before making budget changes is a safer decision, he said. If I overestimate, then there may be cuts that are made that would not be necessary if I understate it. Then we're going to have to cut more than once, if it in fact requires cuts. Another month isn't going to impact us significantly with regards to that process and still gives us time to do budget revisions for the coming school year, Guidry said. Guidry estimated March tax collections were down about $1.2 million from the projections, but he said the effect on the current year's budget should be minimal because offsets exist, like decreased operating costs while students were away from campus for 2 months. Lachele said he's confident Guidry and the district staff will maintain a tight grasp of changes in tax collections. The board president also said if there is a pandemic-related shortfall, he's hopeful the state will be able to step in with assistance through the distribution of federal relief money. All right, and let's go ahead and read another PSA. AOC teams up with United Way of Acadiana for Learn United. The United Way of Acadiana has teamed up with AOC Community Media and other local educational groups for Learn United, bridging the digital gap to provide educational resources for households that don't have internet but do have television. The Learn United programs air weekdays from 8 to 2 on AOC 2, Cox 16, LUS 4, and streaming at aoc.org/watch. For the daily schedules and to submit content for the program, visit the United Way of Acadiana website, unitedwayofacadiana.org/learnunited. And thanks to all those teachers who are putting that content together and putting it out there. You are all now TV stars and also YouTube stars, and you're really just rock stars for helping to keep those children educated and informed as all this shutdown has impacted us all. And I'm sure parents appreciate it. I've spoken with students who appreciate it. You're doing a great job, and thank you. All right. Our next headline, COVID-19 coronavirus, the latest. Area sees big jump in virus cases. New testing labs reporting results for the first time, by Claire Taylor, staff writer. 7 parishes in Acadiana that comprise the Louisiana Department of Health's Region 4 saw a big uptick in new confirmed cases, 135 reported Wednesday. Some of the jump, the largest since reporting started in March, is the result of new testing labs reporting results for the first time. The Department of Health said in a news release, additional tests have become available from the federal government to help states reach a goal of 200,000 tests per month, and people who don't have symptoms are being tested to see if they carry the virus and may be capable of unknowingly spreading it. Statewide, the health department reported 612 new cases Wednesday. Of those cases, 317 are from the new labs reporting data going back weeks, leaving 295 actual new cases in the state. Lafayette Parish Mayor President Josh Guillory said at a news conference Monday that 20 of the 25 new cases reported for the parish on Wednesday were from the new labs. The state enters the first phase of a reopening process Friday, with many businesses reopening after having been closed since mid-March to slow the spread of the virus. The governor's stay-at-home order is also being lifted. The next 3 weeks will determine if we proceed to phase 2 in June, Guillory said. Statewide, the 612 new confirmed cases of COVID-19 reported Wednesday bring the total to 32,662, with 22,608 presumed recovered. The death toll in Louisiana rose by 34 Wednesday for a total of 2,315 dead since the first death from COVID-19 was reported in the state on March 14th. In Acadiana, St. Martin Parish was the only one of 7 in Region 4 to have an additional death reported Wednesday, bringing its total to 22. In the 7 parishes in Region 4, 135 people have died from the virus. As for new cases, the 135 reported Wednesday in Region 4 bring the total to 1,673. Each of the 7 parishes had at least one new case, except Acadia. Iberia Parish reported the biggest increase of 65, with 369 new tests conducted. It is followed by St. Landry Parish with 26 new cases and 353 new tests conducted. Then Lafayette Parish with 25 new cases and 540 new tests conducted. Our next headline, SLCC gets $2.5 million to expand home health care program, a gift from LHC, Myers Foundation, to fund efforts in 6 more parishes, by Ken Stickney, staff writer. South Louisiana Community College is touting a $2.5 million gift, the largest in the history of Louisiana community colleges, as the means for expanding its home healthcare efforts in 6 additional rural campuses in the next 5 years. The gift from LHC Group, a Lafayette-based home healthcare provider working in 35 states, and the Myers Family Foundation, will help SLCC build 6 home health training labs outside of the lab built last year at the Lafayette campus. In addition, it will fund an endowed chairmanship, endowed teaching positions, and student scholarships, and will help create new national credential for home health training. The endowed chairmanship will focus its activities on nursing and home health. This project is especially timely with focus on healthcare through the existing COVID-19 pandemic. Knowledgeable, well-rounded healthcare graduates who can work in the home, clinics, and hospitals are needed now more than ever, Natalie Harder, SLCC's chancellor, said in a prepared statement. SLCC will add labs at its healthcare training academic sites in Ville Platte, Abbeville, and Morgan City in 2020, and at Opelousas, Crowley, and St. Martinville in 2021. They're expected to open in the fall. This is very important work, a lot of what LHC does, SLCC spokeswoman Christine Payton said. They are a leader in the field. She said LHC has partnered with SLCC since 2016 and funded the lab at the Health and Sciences building on campus. They toured the lab and were excited about the training that will happen there, and that's where the new project came from. The labs include a model bedroom and bathroom where prospective nurses and healthcare workers can learn how to tend to patients in the home. Payton said some 350 students are expected to train in the facilities by the end of 2021. She said students will learn what to do at the home, how to talk with a patient, as well as other functions of the job. It's a national example of what we can create together when we focus our resources and our talent to make for a stronger healthcare system for the state of Louisiana, said Monty Sullivan, president of the Louisiana Community and Technical College System. The fact that LHC Group and the Myers Family Foundation chose SLCC among hundreds of other colleges and universities in its service area is humbling, Rebecca Harris-Smith, SLCC's Dean of Nursing and Allied Health, said. Our faculty are some of the best in the nation, and many of us worked in home health, so this project is especially close to our hearts. LHC Group operations employ more than 32,000 workers and spans 35 states and the District of Columbia. Now more than ever, patients, families, physicians, and health systems alike realize care received in the home is among the most important in healthcare continuum, and older Americans increasingly are choosing to receive care in the comfort of home, says Keith Myers, LHC's Group Chairman and CEO. We are proud to expand our partnership with an exemplary and innovative system like SLCC to build greater understanding about in-home health care and to help prepare the next generation of clinicians and caregivers. There's no substitute for hands-on training where students can learn the specialized skills needed to provide quality in-home care. All right, and we are getting close to the end, so I'm going to read this next story, or at least most of this next story, I think. Let's see. All right. The next story is What a Ride. Former UL assistant Munoz enjoys thrilling rise in coaching profession, by Kevin Foote, staff writer. Like everyone, new Baylor wide receivers coach Jorge Munoz has been adjusting to the new normal over the past 2 months. The slower pace of coronavirus pandemic has brought Munoz time to reflect how drastically his life has changed since the end of the 2017 college football season. After 10 seasons as an assistant coach for the UL Ragin' Cajuns under both Ricky Bussell and Mark Hudspeth, Munoz was part of the staff that was fired a day after a 63-14 road loss to Appalachian State in 2017 regular season finale. Munoz had no idea what he was going to do next. I was freaking out, he said. I had no leads, no interviews, no nothing. I couldn't find a job. I always say it's not who you know, it's who knows you. And all the people I knew, there just wasn't anything available. As it turned out, Munoz did know someone who knew someone who knew someone. The result of those 3 degrees of separation was a boost to Munoz's career he couldn't have imagined during the flight to Appalachian State on December 2nd, 2017. As Christmas approached that year, friend and former Cajuns quarterback Jake Delhomme's advice to a concerned Munoz was to give his old offensive coordinator a phone call. Munoz learned of an opening at LSU for an offensive analyst position, so he heeded the advice and called Notre Dame coach Lewis Cook, who had the ear of new LSU offensive coordinator Steve Insminger. All right, and so for the rest of that story, you should go to theadvocate.com. We're coming to the end of our time here on TV and on the radio. I thank you again for tuning in to Local News Live, again a community service of AOC Community Media in partnership with The Advocate. Big shout out to our regular volunteers, Bruce Cohen and Danon. And Danon, I'm not saying your last name because I'm afraid I'll butcher it, but I do need to get with you on the pronunciation of your last name. But thank you both so much for volunteering to read the news. Thank you for tuning in, and stay well out there, everybody.